Hi, I'm Dr. Matt Sheehan from Medford Family Chiropractic Center in Medford, Oregon. It's July of 2000. Yeah, is it really? Well, it's January of 2018, and we're here today to demonstrate several ways to stretch the piriformis muscle. And if you're watching this on my website and you're a patient of mine, I've probably recently shown you how to do this stretch or several of these stretches in my office, and you're a little confused about some of the details, because the devil is always in the details with these things. So this is the one of the stretches we'll be referencing, one of two. And my friend Julie here is here to help us demonstrate this today. So we're going to jump right in, and let me show you first where the muscle is. So here's the view of the spine and the pelvis from the back. Here's one glute area, the other glute area, and the sacrum right in the middle. Now the piriformis muscle, here you see some of the nerves coming off the sacrum. Now these run down the leg. This forms the sciatic nerve, and the piriformis muscle goes diagonally right across the roots of the sciatic nerve. So if this piriformis muscle gets super tight, it could pinch on the sciatic nerve and cause either gluteal pain and or leg symptoms of numbness, pain, or even weakness. All right, so it's often a culprit in a lot of those problems that people come in with. So we're going to show you a couple different ways to stretch this muscle at home. Okay, so I'm going to have Julie lie flat on her back. To stretch Julie's left piriformis muscle, we're going to have her straighten her right leg. You can do this at home either on the floor, on a mat, or on the floor, or on a bed, or on the couch. Doesn't really matter.
Twice.
On the floor, on the mat, or on the floor.
Or on the mat, or the mat, or the mat again, or a mat if you don't have a. In my name's Matt, so there's lots of mats.
Matt, what about the floor?
There you go. Do it on the floor. Yeah. So you can do it anywhere you want where you can lie flat. How's that? Okay. All right, so first thing you want to do is you're going to bring the leg up like this. As far as you can, actively just pull the leg up like this. Now see if you can grab the knee with this hand and the ankle with this hand, and you're going to very slowly and gently bring the leg towards the opposite shoulder. Both the knee and the ankle, you want to pull them both up, just till you start to feel a stretch. The biggest thing I can tell you, the most important part of this, is to not overdo the stretch. Meaning, as you bring the leg up slowly, you're really paying attention to how the left gluteal region is feeling, and when you just start to feel a stretch, that's your starting point. That's where you're going to start. So you're going to hold it there, and what you're going to do is you're already stretching the muscle. That's good, but now how we're going to speed it up is you're going to resist with the hand, both hands on the knee and the ankle. Those are going to resist as the leg actively tries to straighten itself out. Meaning, with this ankle, your ankle is going to be here, let go for a sec. The ankle is doing this. It's pushing down this way, but the hand is lightly resisting. Now, so the ankle is only exerting enough force in this direction for you to actively feel some muscles starting to work. All right? Same thing with the knee. The knee is going to be, let go for a sec, the knee is doing this as well. It's pushing down against the hand this way. This hand resists, the knee and the ankle are coming this way, very lightly, only enough to feel your muscles in the leg starting to engage. If you push too hard, thinking, oh, I'm going to speed this up, and I'm going to push really hard and get well faster, you're probably going to strain the muscle, and you get very mad at me on your next appointment. Okay, so don't do that. Nice and easy, and you're going to hold that. You're going to engage that muscle for 6 seconds. So the ankle and the knee are pushing this way for 6 slow seconds, meaning this is your count. 1, 1,000, 2, 1,000, 3, 4, 5. When you get to 6, then you're going to leave your hands and the knee and the ankle right where they are, but you're going to quit pushing the ankle, and the knee you're going to relax. Then you take a deep breath, in and out, preferably way down in your belly. An abdominal breath is better, and that helps everything to relax. Now what you're going to do is the hands are going to see if incrementally they can pull up a little further. And now you're just checking in for that stretch. And if as you pull up, no stretch, no stretch, no stretch, all of a sudden you start to feel a stretch, that's where you stop. That's your new starting point. And once again, the hands resist, and the ankle and the knee engage lightly this way, trying to straighten themselves out. The hands resist. You count to 6. Then you relax. Deep belly breath. In and out. That's right. And then the hands will pull up again. And you can see Julie's, it's good. She's able to demonstrate moving up incrementally. So you would just continue that way. You could do it 3, 4, 5, 6 times, depending on how much time you have. But if you're still feeling a gradual movement up towards this shoulder, then that muscle, the buttock muscles in general, but primarily the piriformis, are relaxing, so continuing to relax, and you can keep going 3, 4, 5, 6 times, okay? And then relax and do the other side if that's called for. Just so you know, I do not have a handout for this particular stretch. I only have a handout for the next one. For this next stretch, it's done face down. A lot of people like to do it, just like the one I just showed. They like to do this other one also in bed before they get rolling with their day, before they even get up. It helps to release it so you can walk better. Because when this muscle gets super tight, it can be very tough to be vertical and be walking. Okay, so Julie, you're going to be lying face down, actually on all fours, starting out on all fours for me. And so the principle with this stretch is very similar. It's a very similar position to the last one, only you're on all fours. So what you're going to do, Julie, is you're going to bring this, we're going to stretch the right piriformis, which again goes straight across like that. And we're going to start out by bringing this leg up this way and across that way. So if you can bring this ankle to the outside there we go. Now, so this is where you're starting, and you're just going to bring this leg up gradually, again to the point where you start to feel a stretch. And then what you're going to do is you're going to, from here it's all about flattening your whole body out as close as you can to the bed or the couch or the floor. So your hands can slowly come up this way, this leg can slowly slide back, just till you start to feel that muscle starting to engage. And you're going to have to hold your torso up at the point where you start to feel a stretch until it gradually relaxes. And as it relaxes over the course of a minute or two, you'll gradually allow your whole body to go closer to the table. This leg, you're lengthening yourself. This leg will slowly go back further. The hands will go up more. That knee will go closer towards this opposite shoulder, and it will be stretching that same muscle out. Okay? And this will take a little longer typically. It may take several minutes. It could take 1, 2, 3, 4 minutes. But if you're continuing to gradually progress towards there, then you're doing it. You're doing it right. And remember, you want the knee. Initially, a lot of people, the mistake people make will be to bring this knee on the right side towards the right shoulder as you're laying yourself down on top of the knee. If you find yourself doing that, you can either move the knee over, or you could just scoot your torso a little to the right with your hands. Just work your torso over, and that will bring it over bring the left shoulder over that knee. And you'll find yourself feeling a completely different stretch when it's towards this shoulder than if it's towards this one. It's more efficient. Okay? And again, you can stretch that every day. You can do it twice a day, and it'll really help with those issues we talked about. Now we're just going to show you what this looks like from a slightly different angle so you can see a little better. So now Julie's going to stretch the other side. She's going to bring her left leg over across to the right side, and now she's going to slowly lay herself down on top of her knee. That's right. And so now Julie, come on back up if you can, to like all fours, and now can you bring this knee over this way a little bit? Does it stretch over that way? If not, you can try walking your torso just a little to the left. You're limited by the table. But see how she's moving her torso this way? Now her right shoulder is lined up a little better over her left knee. That's the important part, okay? And now as she goes down this way, she's just going to take her time, and she may say, if it's super tight, she's not going to get anywhere near laying her chest down on that. That's the end goal. She may only get a little bit of the way before she goes, wow, that is super tight. I'm feeling it really good there. And remember, with this one, Don't push it to the point where you're feeling an extreme stretch ever. You want to feel just a slight stretch. Otherwise, you could really inflame it, annoy it, and it'll tighten up worse, and you'll be really sorry. Okay? So just take your time with it, and just allow your body to incrementally come down closer, closer, closer to the knee when it's ready. Thanks. How's that feel?
Good.